In the United States, there are nearly 450,000 burn injuries that require medical treatment annually.
We see approximately 250 burns, inpatient burns in our unit a year. We interact with actually infants from the age 4 days all the way up to age 17 years.
What are the most common types of burns requiring treatment?
Common types of burns that we see amongst our patients are skull burn injuries, which are about 90% of the burns that we see. Probably somewhere between 8 to 10% of them are flame burn injuries. A lot of those are accidental injuries, and then other than that, contact injuries when young children grab a hot object like a curling iron or a regular iron or touch a stove.
What is the average course of treatment for a child with a burn?
For a patient who comes to us either through transport or from our ER that has a fairly superficial, maybe partial thickness burn, we will take them to the treatment room, which is very kid-friendly. We use moderate sedation, so our critical care team works along with the plastic surgeons, and the child is asleep. We will debride the wound. We give the parents education on what they need to do with the burn at home, which normally with the types of products that we send them home with, we're one-day admissions. They don't need to do anything but keep them clean and dry. And they follow up in the plastic surgery office in 5 to 7 days, and at that time when they take it off, usually the burn is healed.
When receiving treatment and dressing changes, children may benefit from being distracted in a variety of ways.
So we use distractive therapies for 2 different reasons. We use distractive therapies during the treatment rooms in order to engage the child in looking at maybe an iPad or toys that we have and engage them in that so they're not focused on their actual burn and what the doctors have to do. And then we also use distractive therapies when they're in their rooms, because having a burn injury, even though it may be covered and it may not hurt during that point, it may be itchy or they may be focused on it mentally. So we use distractive therapies at the bedside like a Nintendo or books and games and puzzles and things like that to kind of get that one-on-one interaction so that they're not thinking of their injury.
After receiving treatment, it is important for children to have a sense of normalcy, especially if their burns require them to stay in the hospital.
The playrooms are great use of distraction. We have a lot of children that maybe have a burn on their left hand and they want to come upstairs and they want to play, but they're not necessarily they're holding and guarding that left hand. So we would work with them to maybe play a game and encourage that hand to be used. But it also provides a sense of normalcy. Children usually go out and play. They go outside, they stay inside, they play games, they go to school. Those are all part of their normal days. So having a playroom in the hospital is essential in helping those kids move, get around, and feel normal.
It is important to always be aware of the hazards that can cause burns that are all around us each day. By being aware, we can be vigilant about preventing burns from happening to all children. Keeping our skin safe is important for everyone. There are many easy ways to prevent burns, both outside and inside. Here are some helpful tips. Wear sunscreen when spending time outdoors. Keep children out of the kitchen when cooking. Face handles of pots and pans towards the back or center of the stove. Liquids such as oil and cooking grease can cause a much deeper burn than water. Keep children away from area when cooking. Do not hold hot liquids or food while holding a small child. Check to make sure water isn't too hot before placing child in the tub, shower, or sink. Keep matches out of reach. Keep hot objects such as curling irons, hair dryers, and their cords out of reach. Teach children not to play with outlets or cords and plugs. Make sure items like fireplaces and radiators are blocked from toddlers' reach when on or hot.
Most of the patients that we see here at St. Christopher's, about 90% of them are skull burn injuries. A lot of these injuries happen because of the nature of children at the age of 3 and under. Like, they're very curious, but they don't understand the difference between things that are hot and cold, and they don't know what can happen if they pull something hot on themselves. So you just have to be as careful as you can when you're in the kitchen, or if you're drinking hot liquids like coffee or tea around children, that you have to kind of keep things out of their reach. Sometimes it happens that the child is at a new milestone and the parents don't know that they can do new things like climb up on a stool or a chair to get to things, and things happen that way. And other than that, it's just with the older children, trying to teach them not to play with fire, and that's some of the other types of injuries that we see.
As far as outside, making sure the area is clear of any dangers, like there's no matches or lighters outside in the grass, or in areas that may have had like a fire pit or a grill, just making sure to be aware and keeping kids away from those areas.
Parents can help to prevent burns by doing a safety check around their house. They can make sure that they provide anti-scald devices that are being put onto their water heaters. They can, if the water heaters are set too high and they rent, call the landlord and ask them to be switched over. Also, another thing is make sure they check their cords to all of their appliances and such to make sure that they are functioning properly.